Hello, I'm Pamela Paulet, faculty in the School of Chemistry and Biochemistry at Georgia Tech. I'm an organic chemist by training, and my work spans sustainable chemical processes, chemical safety, and education. Today we are exploring a wicked problem: how chemical exposure vary across job environment and how these differences become an important component of health disparity. This issue sits at the intersection of chemistry, public health, policy, and advocacy. From chronic exposure in beauty salons to catastrophic events like the biolab in Atlanta or the chemical spill in Palestine, Ohio, the impacts are complex and far-reaching. In 2019 alone, the World Health Organization reported 2 million deaths globally due to chemical exposure. In the US, the Occupational Health and Safety Administration, within the Department of Labor, estimates 50,000 deaths annually from occupational exposure. But the burden isn't shared equally. Low-income communities and workers in hazardous industry face higher risk, often with limited access to health care or protection. In Atlanta, incidents like the Sterigenics case in Cobb County and rising silicosis among countertops workers further highlight how local communities are affected. Addressing this wicked problem requires collaboration across disciplines. Let's hear from student researchers who are tackling this challenge from different angles.
Hi, I'm Ava. Our team is focused on silica exposure in the engineered stone workforce. Engineered stone can contain up to 90% crystalline silica, compared to about 30% in natural stones. When workers cut, polish, or grind these materials, they can inhale fine silica dust. Over time, this exposure can cause silicosis, an incurable and often fatal lung disease that leads to inflammation and scarring of the lungs, making it progressively harder to breathe. Engineered stone fabrication is a growing industry in the U.S., and many of its workers, often immigrants or from underserved communities, may not realize that they're at higher risk or may lack adequate protection on the job. We're collecting data from stone shops in Georgia and developing educational materials to raise awareness and promote safer workplace practices. Our goal is to protect vulnerable workers, reduce health disparities, and provide actionable data for legislators and health departments to strengthen prevention and treatment programs. This work connects public health, occupational safety, environmental science, and policy. By integrating these fields, we can create equitable and sustainable solutions. My advice: engage with affected populations. Education and advocacy are powerful tools. Use research to guide policy and learn from global approaches. Stay aware, collect data, and act together.
Hi, I'm Hunter. I'm working on a project that examines exposure to chemicals like atrazine among agricultural workers in rural Georgia. Atrazine is the second most used herbicide in the United States, yet it is banned in the European Union due to its hormone-disrupting effects and its persistence in the environment, which spans decades. We've collected water samples from South Georgia to assess contamination and are preparing to survey farmers about their chemical handling practices. This project bridges science and public policy. Science helps us understand the risks, policy helps us act on them. Together, they close the gap between knowledge and solutions. For students, learn from more than one field. For universities, connect classrooms to real-world problems. And for communities, build trust and collaborate. Real progress starts with shared voices and grounded data.
Hi, I'm Dia. I'm part of the Chemical Exposure Modeling team within the Chemical Equity VIP. We use computational fluid dynamics to model how chemicals disperse in poorly ventilated workspaces, or conditions that disproportionately affect low-income and rural workers. Chemical exposure causes over 180,000 poison center calls annually, yet it's often overlooked. Our goal is to make complex modeling accessible empowering communities with the knowledge to advocate for safer environments. Chemical exposure is a wicked problem that demands interdisciplinary solutions. Engineers, chemists, public health experts, and policymakers must work together. For students, I encourage you to engage beyond your discipline. For universities, prioritize community-centered research. And for communities, co-develop solutions with researchers. Together, we can turn technical innovation into social justice.
Hi, I'm Lily. I'm a part of a team investigating the chemical aftermath of the biolab fire in Conyers, Georgia. We're meeting stakeholders, conducting air sampling around the country, and talking with residents about their experience to gather qualitative data. Based on what we learn, we plan to conduct soil and water sampling to see how the environment is rebounding a year later. While bromine and chlorine were widely discussed early on, we're focused on dioxins, persistent chemicals that linger in soil and water and can harm the immune, respiratory, reproductive, and endocrine systems. Our team's biochemistry background helps us understand chemical reactivity, while collaboration with occupational safety experts sheds light on what went wrong inside the building. My advice? Learn from past mistakes. After major incidents, periodic testing of air, water, and soil is essential. Health tracking must continue over time to predict long-term health consequences. And lastly, never forget the residents. They hold critical knowledge about life before and after the event. Their voices guide meaningful solutions.
Chemical exposure is a global challenge, and it cannot be solved by scientists alone. It demands collaboration across discipline and communities, education, and equity-focused research. Our team exemplifies a transdisciplinary approach, bringing together engineering, science, public policy, communication, and public health experts. We intentionally work across communities, academia, corporations, and advocacy organizations to drive meaningful change. Thank you for joining us.